What does it take to become a doctor? These are the real-life stories of McMaster University's med students. On this episode of Med Students, Karen assists with a lumpectomy. The graduating class get their degrees. And Andrew works the emergency room.
There's quite a bit of fluid in there, and I don't know if that's going to have to be drained or what. It looks like there might be some cellulitis happening.
Today's another big day for first-year med student Andrew Stewart. This morning, he's working anesthesia in the OR, and tonight, he's on duty in one of the city's busiest emergency rooms.
Take the nerve from his hand, or it may have to come from one of his
His anesthesia elective is supervised by Dr. Karen Raymer. Their first patient has a tumor in his hand that needs to be removed.
Mr. Vallet's other medical problem is Parkinson's.
Okay.
So that's what he's on, the levodopa and the benztropine. And then we did examine his airway, but I'd like you to have a look at his airway as well.
Okay.
And stick out your tongue.
Stick out your
Sortez la
tongue.
langue. Sortez la langue.
There you go. Great.
Okay, so what would you say?
Probably Mount Halley 2 or 3.
Okay, so I'll be with you the whole time. Andrew will be with me as well, and he'll be helping me. We'll be working together to look after you.
Go for it.
Go for it. We're going to go for it. Okay. We'll see you inside shortly, okay?
Second-year med student Karen Hill is in the midst of a 24-hour shift in surgery.
Well, today we're at the Henderson Hospital, and this is the what we call lumps and bumps clinic. People come in with different moles and lumps and that kind of thing. Quick procedure, they're in and out as fast as possible. And Dr. Sanders is a surgeon who does this clinic on Thursday mornings.
Karen was just telling me that you had a little lump that's come up on your chest. Is that right? And is this something that you noticed yourself? And do you think that this thing is...
Their first patient, Edith, has had a mastectomy for breast cancer. Now she's found another lump on the same side.
So what do you think we should do?
Well, I think that we should take it out and send it for pathology.
Okay, we already know what it is.
Okay.
But yes, we should take it out. Because
You
that's
think
gonna
it should come out? That's what I asked her.
Now what we're going to do is we're going to have to put a little freezing in there, and we're going to take a little ellipse of skin. So I think the best thing, first of all, we'll take this out, but then we'll also want to set you up for some radiation treatments, because that'll reduce the risk of this coming back.
While Andrew gives the patient oxygen, Dr. Raymer gives him the medication to put him under.
Filled up with as much oxygen as possible for when he goes off to sleep. Another big breath. Grande respiration. Okay, so he's pretty sleepy already. And then you can go ahead and try to intubate.
Okay.
Do you remember the steps?
Yeah.
Yeah? Practicing at home?
I do nothing but dream about it. I've intubated a number of times with Dr. Raymer, and it's still challenging. Like, even now, 4 months after first doing my first intubation, it's still challenging, and I get very nervous.
So doesn't have a lot of flexibility in his neck.
Okay.
And that's the back right tooth there that's got a bit of a crack in it. So just go down and look for the epiglottis.
Okay.
Did you see that?
Yeah.
Okay, and just concentrate on lifting up in that direction. Do you see the vocal cords? Okay, hang on. Do you see them well? That's good.
Yep.
Okay. And just try and gently pass the tube. Okay, now what I want you to do is concentrate on lifting up. Okay, good. Now, did you see the cord, the tube go through the cords?
Yeah.
Okay, let me have a look.
Okay.
Okay, good. Take a breath.
Andrew will assist Dr. Raymer to keep the patient anesthetized throughout the surgery. Karen prepares to assist Dr. Sanders with Edith's lumpectomy.
Goes in, you're going to feel a little needle prick, and then you'll feel a burning. We'll just start
As a
right
former
here.
nurse, Karen has plenty of experience with syringes.
If you're feeling any pain, you need to let us know so we can put some more freezing in. Okay.
What she doesn't have is a lot of experience with a knife.
Today was like the second time I ever actually held the scalpel in my hand and, cut. Yeah. I'm always kind of afraid that I'm going to cut too deep, though.
Let me just take the first little bit
Yep.
here.
Dr. Sanders ensures the lump is removed with a good margin. But Karen finishes the job.
Okay. Very good.
Mouth's awful dry.
Your
I
mouth's
need a
dry.
cool drink like a Coors Light.
Don't touch your hand, love. Don't touch your
Andrew and Dr. Raymer prepare to wake up their patient.
Everything's fine.
Nice deep breath. Surgery's all done. Hand on his chin and you'll feel his breathing.
Andrew's final job is to decide on the patient's postoperative care.
So do you want to write some orders for me, Andrew? So, what is he going to need?
So we're going to need an antiemetic.
Antiemetic, okay. So which one will you order?
Is it? I'm not sure.
You have to pick it yourself.
Okay. You get to a point where you're just like, is this actually, can I actually become a doctor? Because there's so much information and you have to be so responsible and there's just so much pressure and it's such a high stress job and you wonder do I actually have, is this right? Is this what I should be doing? Because I'm just way overwhelmed and I'm just like, you know what? Bad idea. I don't know what I'm doing.
It's graduation day for McMaster Med students.
I don't really know what to feel. You're excited in a way, and yet in another way, I know this is just the start. This residency is when I think we're really going to learn and when you're really going to be faced with the situations and putting everything we've learned to the test. So of course this is an exciting day, it's great, but it's definitely not the end, that's for sure.
Before the diploma ceremony, when they get their degrees and formally become doctors, the class of 2002 gathers for a solemn moment to take the Hippocratic Oath.
There is after we repeat the Hippocratic Oath. I solemnly swear by that which I hold most sacred.
I solemnly swear by that which I hold most sacred,
With my teachers, family, and friends as my witnesses,
that I will be loyal to the profession of medicine,
and honest and just to its members,
that I will practice my art with honor,
that I will continually seek to increase my skills,
that into whatsoever house I shall enter, it shall be for the good of the sick and of the community to the utmost of my power.
I'm so thrilled today.
Oh, you're making me cry.
What a milestone. Well, I'm going to cry too.
But I couldn't have done it without your help, Mom.
Very proud.
is my Hippocratic Oath, actually, which I just swore. I call it the I do of medicine. Technically, I'm not a doctor yet. We have our afternoon ceremonies where we gown up and we receive our diploma. And that's when I can officially be named a doctor.
Yes.
Now that Edith's lump has been removed, Karen closes the wound.
Which isn't too bad.
Why does that not look right?
Because it's not that correct, unfortunately. So let's start over.
Okay. Do you? I hate sewing with a machine. I've never been able to do it. I've sewn many things by hand.
Oh, I get it.
Good, we're done. Good.
So it's Friday night, and I'm doing an emergency room shift with the emerge doc that I work with at St. Joseph's Hospital in Hamilton. The last time I worked at Friday night, I got to do a lot of suturing. I got to do some other things like that. So it can be anything. Yeah, hard to say. Great. Glenn? Yeah. Hi, I'm Andrew.
Andrew's first patient in the ER has a swollen arm.
Okay, so why don't you tell me what happened?
Well, I went to get blood taken yesterday, and they tried a few spots. They couldn't find any.
So when did you notice this swelling and this discoloration
This
happening?
morning when I woke up.
Okay. And has there been any changes in the last, since you woke up this morning, from the swelling?
No,
Okay.
not really. It's as hard as a rock.
And it's painful,
Hurts. Yeah.
Oh, wow. Okay. I think what I'm going to do is go and get Dr. Cherry and his staff guy to come and have a look at it. My suspicion is that there's quite a bit of fluid in there, and I don't know if that's going to have to be drained or what. It looks like there might be some cellulitis happening, which is, could be infection in the dermal layer of the skin. So I'm going to go get Dr. Cherry in, and he'll come back and have a look.
Okay.
And then we'll go from there, okay?
All right.
Okay. Thanks, Glenn.
Thank you.
After 3 grueling years, the class of 2002 are about to receive their medical degrees.
I declare that the 386th convocation of McMaster University for the conferring of degrees is now in session.
It's their last moments as med students before they become doctors.
I'm excited. I hope I don't flip. That would be embarrassing.
Alyson Mary Brodeur.
Congratulations, Alyson. I admit you to the degree Doctor of Medicine at McMaster University. Good luck.
Now you'll have to call me doctor.
David Philip Hernandez.
I admit you to the degree Doctor of Medicine at McMaster University. Good luck.
Amanda Diana Marrone.
Congratulations, Amanda. I admit you to the degree Doctor of Medicine at McMaster University.
Thank you so much.
You're welcome.
Dr. Amanda, I like that. Or just Amanda. I haven't really changed my person. I'm still me.
No, I'm not going to call you Amanda.
Yeah, Amanda's fine.
I'll call you doctor.
You know, all of a sudden it's like people are calling you doctor. I don't know, it just doesn't sit right with me yet. You know what I mean? You guys have seen me in the hospital, what I do. I don't really know what I'm doing yet.
They'd better get ready soon. After a short vacation, the graduating class will be back at work as first-year residents. Andrew brings in Dr. Joseph Cherian to look at Glenn's swollen arm.
Go into one area, try and grab it from that area.
When did you have this blood work drawn?
Yesterday.
Yesterday. You got this much swelling.
Yeah.
Can you feel me touching you?
No. Yeah.
And to bend it and straighten it, how does it feel?
Like, up there.
Does it hurt or does it just feel tight?
It hurts.
It hurts. I'm just looking at the degree of edema that he has there. And I mean, to follow this up, if it goes much further, it's going to be into his axilla.
Right.
I'm maybe inclined as to whether this gentleman might need in-hospital treatment because he's going to have that arm rested.
Yeah.
What would you like to do for him?
What would I like to do?
Yeah.
Do some blood work.
Yeah.
Take look at CBCs and
the big thing is going to be treating the infection and elevation of that arm and complete rest of it. So why don't we get that stuff started on him?
Glenn will be seen by an internal medicine specialist to determine if he needs to be treated in hospital. Karen's next patient, Donald, needs part of his ingrown toenail removed.
Sit still for it. So we're going to put some freezing here. The freezing needle, when it goes in, is painful too, but we'll try to go slow so it's not too bad. And just laterally there. Now this will be painful. You need 2 hands on it. Pardon me?
You want to hold it down?
Yeah, I got it.
Okay.
I've never done this kind of surgery before. I've had it done to myself. Yeah, I've had this done. And the person who did it for me froze the area. And it hurt, awful, awful, awful. Okay, which way am I going in like this?
You want to go in like that so that you're going to hit the lateral edge of the bone there.
Okay.
So just about midway across there.
Should I go down?
Yeah, no, just put a fair bit in there. Move the needle in and out a little bit. Freezing directly into skin is frozen right away, but if you're freezing a nerve, it takes a little time for that to infiltrate through the nerve.
Okay.
So if we just leave it for a couple of minutes and then come back.
Kingston, Ontario. 2 months after graduation, Dr. Alyson Brodeur is about to start her pediatrics residency at Queen's University.
Started at 7:45, and I'm actually on call my first day, so I won't be leaving the hospital until about noon Wednesday. So it will definitely be a big day. Hopefully everything goes well. It's a little scary being on call your first actual day as a doctor, but you know, it's the way it goes. This is the beginning of, I guess, a new chapter of my life, trying to become a doctor. So.
Hi. Hello, I'm Dr. Marrone, and you can call me Amanda.
Amanda Marrone is already on the job as a first-year rural family medicine resident at McMaster. Her first patient, Kara, has a rash.
Yeah.
Okay.
Tell me about it. This morning I woke up with it and got all over my arms and legs.
Okay. Your cat didn't scratch you or bite you or anything like that yesterday? Okay. The 2 things I was thinking of was a viral rosanthem, we call her a viral rash. It could be some kind of a contact dermatitis.
Amanda will consult with the supervising physician to determine the cause of Kara's rash.
I'm just gonna have a talk with the doc, and I'll be back.
My hands are wider though.
Karen and Dr. Sanders glove up before removing part of Donald's toenail.
And then this also is kind of a sawing action going down through here.
So it's more pressure down than forwards?
Well, it's like cutting bread. That most of the incisions we make in the operating room, you see just a straight line cut. Whereas this, because it's so firm in there with the fibrosis and scar tissue, that to make a firm line cut, it takes a lot of pressure in it. Let this part go. This is your instrument. That's what
Oh, okay. Oh,
so
okay.
you want to put that in.
Okay.
That's it.
See, I'm lucky I have kids and an accident-prone husband because I've done many dressings.
Okay. Now,
In 1 more year, it will be Karen's turn to graduate.
I'm gonna be the happiest when I finally get my degree and get through here because it'll be like, oh, you know, because sometimes it feels long, and other times it feels like, wow, it's almost over.
It's almost midnight. Andrew gets ready to go home. It's turned into a tough night.
The night started out with a pretty serious case at the beginning, and the patient ended up dying, actually, so that was the first time that I ever experienced anything like that before. So it was really upsetting. She was quite young, and one of those surprise cases that you don't expect to happen. So that's sort of something I've never experienced before as a medical student, and so I don't know, this is probably something I'm going to be thinking about for the next couple of days, just digesting it, and maybe talking to some of my classmates about it. But I knew this day would eventually come, but yeah, I don't think anything prepared me for it. Yeah.
Andrew's graduation is still 2 years away.
I think I feel, although I'm still young, I feel more mature now that I've gone through a year of medical school, or almost a year of medical school. Like, I sort of feel like I have a bit more experience under my belt and a bit more, life experience, I guess. So, I'm off. See you later.
I discussed the case with our staff physician. We agreed that whatever it was causing, she could have had exposure to something, anything throughout the day that could have caused this. This was definitely nothing serious, something that we could send her home with some Benadryl to help with the itching, to prevent her from scratching and developing an infection. So it has a happy ending. That was good. It was a very good look. I like rashes because they challenge me, and I'm sure I'll see a lot of it in family medicine, so it was very useful. Every new case is a learning experience. I'm still as excited. That's one thing that hasn't changed, if not, it's increased. I'm still as excited about medicine as I've ever been. In fact, maybe a little more now because I see all the things that I have the potential to do. It'll be neat to look back in 20 years from now and say, oh my goodness, I remember the days when I was a clerk or I was a resident. It'll be nice to hopefully be able to say, wow, you did it, and you're good.